Hello. Um, so I think we kind of got cut off somewhere in between. But anyways, gonna let you kind of look through some of these things again, just so you guys can review or use as a review um, while you're studying for the exam. And feel free to ask questions. This whole thing is like a learning environment. We're all learning. Um, and I understand it's difficult, to be studying through all of this. So, and, doing other things. And so, but anyways, I think we left off right after the sepsis, which is a septic shock. We looked at how patients will experience like sepsis with hypotension, may require some vasopressors. Previously, we looked at the different types of sepsis, severe sepsis, septic shock, especially when they're going to get um, when they have like low blood pressure, and despite the fluids that they're on, they're going to need a little more than that to bring them back up to normal. So we already talked about some of the uh, things with sepsis earlier, regarding like, patients should be on fluids, like normal saline or lactated ringer solution so that they can be started on that, and then they would be started to be they would start getting treated for like the infection, their heart rate, the blood pressure. That all needs to also play a role, specifically for sepsis. Now, there might be new guidelines out there for like sepsis treatment and all, so I would highly recommend you guys look at the latest information, specifically when the exam is going to probably look more into, probably not going to be very specific, with like the guideline based information, but I would at least take a look and see if there are any changes within the sepsis guidelines. Um, Also, for the infectious disease part, so you would probably want to look into the ISDA guidelines, or IDSA guidelines, I'm sorry, and see if there was any changes there. Um, then, these are some of the medications that they would be on, like dobutamine for the heart rate or stimulating the heart. And then um, sometimes patient would be on like adrenaline, noradrenaline. That is very much like one of the most important classes of medications patients should be on, especially when they're being treated for when they're being when they're high, or the blood pressure is very, very low. Then yes, they have to get um, some sort of treatment for that. So it's very important to have a vasopressor on board when it comes to patient having a septic shock. Um, Empiric broad spectrum antibiotics is, is definitely a very important um, uh, class. If medications needed necessary to treat um, various types of infections that might be harming the different organ parts in the human body system, and which may lead to further infection and stuff. So um, while the while waiting for the cultures to get back, it's uh, necessary to have some sort of empiric broad spectrum antibiotics. Here in this case, you see Zosyn and cefepime, Vanco. You probably already seen it in my previous videos, that uh, you know, a lot of these meds, they're going to kind of repeat in different types of diseases. So you could be having a patient with a multi, um, I don't know if I want to say multi-state, but anyways, the patient might have multiple diseases on their medical history, and that are multiple different types of infections. And then, most of these infections could just be used by the similar types of antibiotics. So, like Zosyn and Vanco, and cefepime being used, or meropenem, and those kinds of things to treat the main Pseudomonas and the MRSA infection. So, uh, very important there. Hydrocortisone. Patients might need a little bit more vascular responsiveness, so they're going to need some more they're going to need some hydrocortisone there. Specifically when dealing with some sort of inflammation and stuff. So, and as I mentioned in previous videos, the hydrocortisone, it's going to bind to that glucocorticoid receptor, so it's going to need some of that, responsiveness there. Drain abscess, remove catheter, whatever is needed to make sure the patient is back to its stable state is very, very important, to make sure all of these types of medications are used to treat this patient and get him back to normal. So just as you're looking at your NAPLEX books, definitely take note of some of the important types of medications required to treat a patient who might be at sepsis state or septic shock state. Because you might have a case on the exam that might ask you a question as to what medication to add on as a therapy for a patient in this septic shock state. And so these are just some of the listed ones. I believe you guys should at least have a general understanding as to what medications are required. But remember one thing, when it comes to sepsis, they have to be started on IV fluids, either normal saline or lactate ringer. So, just note that as one of the like a distinguished, or like one of those types of medications that not commonly seen in a lot of the disease states. So you need to understand that. Any questions? Okay. We're just going to quickly go over this because this was just supposed to be finished a little while ago, since we were kind of cut on our during the time when I was doing that presentation earlier. So this is just the second half of that portion. So in terms of skin and soft tissue infections, sometimes patients would have like gram positive, gram negative, anaerobic type of infections. Again, some of the medications are going to be very similar here. Vancomycin, you might have some metronidazole because of the anaerobic parts of it. When it comes to skin and soft tissue infections, what definitely comes into mind is definitely knowing that patient might be diabetic and might have a diabetic foot infection. You need to know what to actually treat in that case. So note that Staph aureus, strep pyogenes, these are some of the types of bacterial infection patient could have when they have like a infection like this. Sometimes patient might have impetigo, and those are the types of like skin infections, you might see in a patient, and that they would need to, those might not require more invasive therapy or like IV or oral type of treatments. It might just require like a topical mupirocin ointment or cream. And so here I listed some of the types of things that could occur when a patient is having a skin or soft tissue infection. Um, you can see here in pedigo more like honey-colored crust in the skin, or cellulitis, which is like red warm skin. Um, so that you might see patients might have some abscess or necrolized fasciitis, which these are a little more invasive type of therapies, but they are still um, there's still a possible chance that patient could be experiencing this, so that's why they would probably need those kind of antibiotic treatments as an IV treatment on board, such as vancomycin and zolpidem for the extreme um, gram positive and gram negative coverage, especially someone who has MRSA and the Pseudomonas infection there. Someone having abscess might need more of a surgical procedure like incision and drainage, or um, diabetic foot infection might just require some more of the gram positive coverage like augmentin, which is amoxicillin clavulanate, a little more stronger than a normal penicillin type of antibiotic, but still has good coverage. Zosyn, carbapenems, you might need some more of that Pseudomonas coverage there, because of the polymicrobial type of infection you might have on the diabetic foot. And then for cellulitis, you might see patients who has a mild cellulitis, then you're just going to need a Keflex or augmentin. Um, they have MRSA risk, then add on a Bactrim, or just have a Bactrim, doxycycline, clindamycin, any of those kinds. So if it gets like real extreme, then obviously you want to use something Vanco or something to make sure to mitigate that. Um, and that's pretty much here on this. There probably might not be that many questions on this kind of disease state, but at least um, I would recommend you look over your NAPLEX books or materials and see what type of skin and soft tissue infections there are and what the available treatments would be. And, those would probably be the latest updated information on that. And then the next thing I wanted to talk about was the urinary tract infections. That usually can occur in the lower and the upper part of the urinary tract. You can have patients who might have a bladder infection, or it might be up to the kidney infection. So you just gotta take a look and see. Patient doctor would have to diagnose that and figure out where the infection is and what type of infection is it, what kind of bacteria is infecting those parts. Um, Typically more of the intestinal areas or the urinary tract infections, you're going to need more of the, you probably have seen this in practice, but usually patients will be prescribed something like macrobid or nitrofurantoin. Patients might be prescribed something like phosphomycin. So just note that these are types of medications that are used for that kind of disease state. Otherwise, questions on tests, you don't want to get confused between what medication to use. This is going to be easy questions. You guys should understand. And if when it comes to a question regarding penicillins, um, you guys should first look at like the penicillin allergy. If there's any penicillin allergy, then that's not, that medication with the penicillin type of medication is not going to be used. So just note that. But when it comes to like urinary tract infection, you might see someone taking, um, having to take, or, you know, macrobid or phosphomycin. Um, those are typically you would see would be what patients will be prescribed when they have a urinary tract infection. It can be uncomplicated or complicated UTI. So when it's uncomplicated, usually a patient might have difficulty with urinary urination and stuff, because it's probably occurring more in the cystitis part, which is the bladder infection. So you can see here like nitrofurantoin, Bactrim. Bactrim might be one. Um, Patients could be on like either the single strand or double strand Bactrim. So, just giving you an idea there. The next thing here is the fosfomycin. Patients might be on that. I haven't seen it too much in practice, but yes, there have been patients on fosfomycin as well. Now, in other cases, before patient, uh, sometimes patients take cranberry tablets or cranberry or drink cranberry juice or to prevent further urinary tract infections from occurring. That is for prevention. That's not for treatment. Now, just note that, if it's on a test, you want to definitely look at prevent versus treat, because prevention is going to be something like cranberry juice or cranberry tablet. Treatment is going to be something like these kind of antibiotics to treat it. Sometimes patients have pain when they have urinary tract infection. When it comes to pain, they might be taking something like azo. Azo is typically like a 2-day type of medication. It's mainly used for the pain in when they're experiencing urinary tract infection, but that's not going to treat the infection. So to treat the infection, you have to use an antibiotic like nitrofurantoin, Bactrim, fosfomycin. Now they can prevent further urinary tract infections from occurring, but they can't treat or kill the bacteria without having these antibiotics on board. And then when it comes to complicate urinary tract infections, this can occur to anyone. This can be happening in men, could happen in pregnant women, could happen in anyone, um, uh, even someone with a diabetic foot infection. Um, when it happens, it's going to usually be more into more complicated sites, a more broad spectrum antibiotic is going to be needed. Such as like ceftriaxone, Zosyn, fluoroquinolones like ciprofloxacin, levofloxacin, those kind of things, because you might have some pyelonephritis or maybe something dealing with the kidneys here. It's going to become more complicated. So that was pretty much it there. This next section is a slide on vaccination. Vaccinations like patient might need a vaccination to cover for hepatitis, flu, polio, Tdap, pneumonia, shingles, COVID, RSV. I In the exam they might ask maybe one question on vaccines, or they might ask multiple questions, but you guys should at least know a couple of things when it comes to vaccinations, like what type of vaccine. Well, they might ask like what will be the best vaccination for prevention of a tetanus virus, or what's the best vaccination for prevention of whooping cough. When it comes to the vaccinations, um, and this is a very important slide, especially since it has a little bit of role in infectious diseases, because these are viral diseases. This is also part of infectious disease. And you guys should know vaccinations really well. As pharmacists, we have to know, is the vaccine appropriate? Sometimes you got to check your state immunization records and registry records and see, has the patient had it before? Is this the first time they're on it? Have they taken it before? Because some of these vaccines are only taken once in a lifetime, or once every 10 years, or once every 2 years, or once every 5 years, and so you have to understand the timing of these vaccinations. Is the patient pregnant, or is the patient not pregnant? Is this vaccine appropriate for a pregnant patient? So you should know that live vaccines you should not use in a pregnant patient. Someone who needs to get a flu shot but wants to get intranasal flu vaccine is not going to be appropriate for someone who is pregnant. It's gonna be more so in like patients who are not pregnant. So definitely know that. Zostavax. Zostavax is not used anymore. It's actually Shingrix. And Shingrix is a two-shot vaccine, so you would need to get it first. Uh, you could get it one time, and then after that, after maybe 2 months, you would get the second shot to complete the series. So you need to know the timing. Between 2 to 6 months is usually recommended to get a Shingrix vaccine. The COVID vaccine, it comes as like Comirnaty, Novavax, Spikevax. There were various others, and some of them fell off the market, so they're not available anymore. But um, they are also important vaccines for patients who haven't received a COVID vaccine or who are eligible to getting it, or you know, and knowing the age range too. In I know with certain state restrictions, these are the age groups that pharmacists can give vaccines. So, but all of these vaccines can be given by pharmacists. So at least for the exam, you should understand that these are main vaccines. Um, Also knowing that hepatitis vaccine, you could give a hepatitis A vaccine or hepatitis A and B vaccine or hepatitis B vaccine. So you have to know like the different brand names as well of all of these vaccines as well. Um, Flu shots, you probably have seen Fluzone HD, Fluad, Flucelvax. These are all different brand names of the vaccine flu shot. Polio, then you got Tdap, pneumonia, RSV and Briswell. Um, when it comes to RSV, understand that you should only be getting that once in a lifetime. So, um, and then MMR, I'm sure you have seen MMR or maybe have given it in your practice, but MMR is usually given as a subcutaneous vaccine. So also knowing the um, um, also you should know which which um, um, intramuscular or which route of administration the vaccine should be given. Should it be given intravascularly? Should be given intramuscularly? Should be given subcutaneously? Just understand, which route of administration it should be given, how it should be given as well. You guys should understand, 90-degree angle versus 45-degree angle, because you might have a question on a test on something like this too. Even if something as simple as like this, Tdap, how often should it be normally given? Normally, you should be giving a patient Tdap every 10 years for specifically for tetanus. A patient might have whooping cough and they need a vaccine, but they already vaccinated, so they probably would not need a whooping cough vaccine, even while their vaccine is still in their system. So don't get confused by that question. So, um, and you might see some live vaccines. Patient is traveling, they need to get some kind of typhoid vaccine. So they would take some kind of oral vaccine here. Um, and that's pretty much it. Tuberculosis, BCG is not given in the US, but they are sometimes given outside and US to treat tuberculosis. And when it comes to tuberculosis, usually just tested here in US to figure out whether there's a risk of TB or not. And we have already discussed a whole lecture on TB previously, so I would recommend you guys at least take a minute to review that, the types of medications used in the TB, and understand right therapy and all. So um, definitely look at that. Um, that's pretty much it here. I know these brand names, okay, and I listed these questions out for you guys so you guys can kind of understand, things to understand, like brand names of these vaccines, age groups, pregnant or not pregnant, live or inactivated, how is it administered, SC or IM, the timing, should it be taken every 2 months apart, should it be taken every 5 years, should it be every 10 years, every year? Because you already know that, flu shot is taken annually. But what if the patient has egg allergy? Can they take a flu shot uh, with Fluzone, or should they be taking a flu shot that is something like flu block, which doesn't have egg in it? So what's more appropriate? And knowing that as well. So hopefully that kind of helps here, so you guys can see that. And then this is just a hepatitis B chart I just listed here for your reference. You guys can take a look at the brand names here too, and also seeing the dosing recommendations uh, by age groups as well. For children over 1 year and adults, you can see here is a 3-dose series, like for the Ngrix, recombinant, and the Twinrix. You can see in the name like Rix in there, Vax and Rix. You're gonna take it 3 times, and then this other one, the hapless Sav, is just 2 times. And then I want to list one important slide here because we already someone had posted and mentioned about HIV virus. We talked about HIV infectious disease previously, and so this is just a chart here that just talks about like the stage 4 of the disease, HIV. As you can see, like this is one of the medications that could be used to prevent it. Uh, as the Landis Casper, you can see here how it's kind of like in the process, it has its reverse transcriptase and all this programming, and also just trying to prevent it from doing that programming, and also preventing it from going out of the human host cell to infect other parts. Um, so I just wanted to kind of show you a preview of this here so that you guys can look more into it if you need to. I personally don't think that you will see a lot of about this on your exam, but for your reference, if you wanted to go over this, this one is typically the stage where opportunistic infections will occur, and then you're going to have a CD4 count of less than 200, and then other types of medications will be needed in this case to treat that type of infection. So definitely just glance over that just in case you might see a question on a test regarding any of the opportunistic infection. I don't think the pictures or like how it's going to prevent the process is going to be asked, but at least I would look over like the treatments and stuff that's used against the opportunistic infections after the stage 4 of HIV. So I hope that helps. And if you have any other questions for me, please feel free to uh, list it here in the chat and just let me know, or you can just just post it on the YouTube channel, or you can just you know you can go on the Facebook page and let us know as well. So I hope you all have a great day and happy studying. If you, I will also try to prepare some questions for you all, so you guys can use the questions as a review guide, specifically for treating for infectious disease parts of it. There are uh, these questions might be a little more specific than what's on these slides. Because we want to make sure that you're well prepared for the exam. So to take a moment and also review the questions, and look over your materials, review the books, um, and you should be able to get it all. I kind of already showed you there's a lot of commonalities here between like the different disease state treatments, um, or the sub-disease states here of the infectious disease, so that you guys can utilize that information to help you for the test. So I hope this all helps you out, and I hope you all have a great day. Um, Thank you for watching, and hope I see you all again soon. Thanks. Bye.